Jeghers Syndrome. Di Vera Barrio Nueva. Introduction. Often abbreviated, Jeghers is autosomal dominant genetic disorder. Characteristics be the development of benign hematomatous polyps in the gastrointestinal tract and impigmented maculas on the lips and oral mucosa melanosis. These syndromes can be classed as one of various hereditary intestinal polyposis syndromes or of various hematomatous polyposis syndromes. Video. Normal follow up colonoscopy sensor. Mother enter in the stomach. The stomach is the mucosas. Introduction in colonoscopy. Instance Gov HTTP is and the mucosas and is the jejunum is the polypus is a struct intestinal into mucosas. Application nursing. Some suggestions for surveillance for cancer included the following: small intestine with a small bowel radiographic every 2 years, esophagogastroduodenoscopy and colonoscopy every 2 years, CT scan on MRE of the pancreas yearly, ultrasound of the pelvis and testes yearly, mammography from age 25 annually, Papa Nicolau smear, pap smear annually benign acted. Follow-up care should be supervised by physicians familiar with Peutz syndromes, genetics consultation and counseling, as well as urological and gynecological consultations are often needed. To video.
Peutz-Jeghers syndrome is an autosomal dominant condition caused by a germline mutation of the serine threonine kinase 11 gene, usually located on the long arm of chromosome 19. Multiple hematomatous polyps occur in the small intestine and colon. There is a significant risk of small bowel or colonic adenocarcinoma, and of cancer of the pancreas, lung, testis, ovary, breast, and endometrium. Clinical features. Most cases are asymptomatic, although chronic bleeding, anemia, or intussusception can occur. Also associated with melanin pigmentation of the lips, mouth, and digits. Diagnosis. Diagnosis requires two of the three following features: small bowel polyposis, mucocutaneous pigmentation, a family history suggesting autosomal dominant inheritance. Management. Affected people should undergo regular upper endoscopy, colonoscopy, and small bowel and pancreatic imaging. Polyps greater than 1 centimeter in size should be removed. Asymptomatic relatives of affected patients should also undergo screening. Thank you for watching. For more videos,
Pros and cons. These diseases as only cons having Peutz Jeghers syndrome increases a person's risk of developing types of cancer, digestive system cancer, stomach, esophagus, small intestines, pancreas, colon or rectum, breast cancer, females, uterine cancer, females, a rare type of cervical cancer, females, lung cancers, tumors of the ovaries and testicles can be cancerous and non-cancerous because Jeghers syndrome is hereditary. The conditions can be passed from parents to children in a family. Peutz Jeghers syndrome often varies in how severe it is even among people in the same family. Some people might have many polyps and might develop cancer at a young age, while others might only develop affect polyps and might not develop cancers. So video.
Peutz-Jeghers syndrome, named after Dr. Jan Peutz, who first described it, as well as Dr. Harold Joseph Jeghers, who later reported on it, is a rare autosomal dominant condition in which individuals develop polyps throughout their gastrointestinal tract, as well as dark spots called melanotic macules in their mouth, lips, genitalia, palms, and soles. The large intestine is found in the abdominal cavity, which can be thought of as having two spaces, the intraperitoneal space and the retroperitoneal space. The intraperitoneal space contains the first part of the duodenum, as well as all of the small intestines, the transverse colon, sigmoid colon, and the rectum. The retroperitoneal space contains the distal duodenum, ascending colon, descending colon, and anal canal. So the large intestines essentially weave back and forth between the intraperitoneal and the retroperitoneal spaces. Now, the walls of the gastrointestinal tract are composed of 4 layers. The outermost layer is called the serosa for the intraperitoneal parts, and the adventitia for the retroperitoneal parts. Next is the muscular layer, which contracts to move food through the bowel. After that is the submucosa, which consists of a dense layer of tissue that contains blood vessels, lymphatics, and nerves. And finally, there's the inner lining of the intestine called the mucosa, which surrounds the lumen of the gastrointestinal tract and comes into direct contact with digested food. The mucosa has invaginations called intestinal glands or colonic crypts, and it's lined with large cells that are specialized in absorption. Peutz-Jeghers syndrome is caused by a mutation of the STK11 gene, which is a tumor suppressor gene that codes for a protein called STK11. So without a functioning STK11 gene, the gastrointestinal cells are more likely to accumulate mutations and start dividing faster than normal, ultimately giving rise to polyps. These polyps are benign outgrowths that arise along the gastrointestinal tract, mostly in the small intestine, but also in the stomach and the large intestine as well. Some polyps then go on to accumulate additional mutations in other tumor suppressor genes, like the KRAS gene and P53 gene, and at that point they might evolve into cancer. The chance for any single polyp to develop into cancer is generally pretty low, but for people with many polyps, like those suffering from juvenile polyposis syndrome, the risk for cancer becomes significant. The STK11 gene is expressed in a number of tissues, so individuals with Peutz-Jeghers syndrome have an increased risk of developing extraintestinal cancers without polyps, like pancreatic, breast, lung, ovarian, uterine, and testicular cancer. Polyps can be classified by their gross appearance. Some are flat, which means that they don't protrude into the lumen from the mucosa. Some are pedunculated, which means that they do protrude into the lumen and remain attached to the mucosa by a stalk, kind of like a mushroom. And some are sessile, which means that they also protrude into the lumen, but there's no stalk and the entire tumor is attached.
Sue applied in Ecuador. On Ecuador, the majority of the cases seems to be caused by mutations in the germline of the tumor suppressor genes. Patients present a significantly higher risk of digestive and non-digestive cancers. It is possible that the genetic defect affects tumor suppressor genetics. Digestive cancer involves the pancreas, stomach, small intestine, and colon. Non-digestive cancers include diseases that affect the breast, lung, uterus, ovaries, and testicles. In this video.
Hey guys, and welcome to How to Gastro. In today's video, we will be talking about Peutz-Jeghers syndrome, which is also commonly known as PJS. So let's get started. So what is Peutz-Jeghers syndrome? Peutz-Jeghers syndrome is an autosomal dominant inherited disorder which is characterized by intestinal or stomach hematomatous polyps together with a distinct pattern of skin and mucosal macular melanin deposition, which is usually on the lips, around the inside of the mouth, near the eyes and the nostrils, and around the anus. These spots may also occur on the hands and the feet. People who suffer from Peutz-Jeghers syndrome also have a 15-fold increased risk of developing intestinal cancer compared with the general population. So these are the macular melanin deposits that are found. They're very characteristic for Peutz-Jeghers syndrome. And they're found on the mouth, near the eyes, the nostrils, usually on the mucosal areas. And these are the polyps, the hematomatous polyps, which are found within the intestines and the stomach of these patients. So these are two characteristic features of Peutz-Jeghers syndrome. Something to note about this disease is the risks associated with the syndrome include a strong tendency of developing cancer in a number of parts of the body. While the hematomatous polyps themselves only have a small malignant potential, less than 3% chance, patients with this syndrome have an increased risk of developing carcinomas of the pancreas, the liver, the lungs, the breasts, the ovaries, the uterus, the cervix, testicles, and other organs. So let's go back to this picture of the polyps. So these polyps themselves within the intestines, they have a 3% chance of malignancy. So these hematomatous polyps are usually benign, but they can have malignant transformation in 3% of cases. But what's very characteristic about patients who suffer from this syndrome, they have an increased risk of developing cancer in other parts of the body. And in the next slide, you'll be able to understand why, because the actual risk of them developing all these other cancers lies within the genetics of the syndrome. So let's talk about that now. The genetics. Peutz-Jeghers syndrome is an autosomal dominant inherited disorder, which means if one of your parents has the disease, you have a 50% chance of inheriting the gene and having the disease. The mutations in the STK11 gene, also known as LKB1, cause most cases of Peutz-Jeghers syndrome. The STK11 gene is a tumor suppressor gene, which means that it normally prevents cancer cells from growing and dividing too rapidly or in an uncontrolled way. A mutation in this gene alters the structural function of the STK11 protein, disrupting its ability to restrain cell division. The resulting uncontrolled cell growth leads to the formation of non-cancerous polyps and cancerous tumors in many parts of the body in Peutz-Jeghers syndrome. So if you look at my picture on the left, you will see I put in a set of chromosomes here, and this is chromosome 19, and we're looking at the short arm or the P arm, And here is where we have the STK11 gene. And here is where people who suffer from Peutz-Jeghers syndrome have a mutation, a gene mutation, which means there's some sort of an abnormality that occurs at this section. But this gene is also important because it helps our body suppress the formation of cancerous cells. So because we have a problem with this gene, not only does the patient have those melanin deposits on their lips or those polyps in their stomach or their intestines, they also now have increased risk of cancer. And this is why people who suffer from Peutz-Jeghers syndrome are more prone to the development of all those different cancers we spoke about earlier. Breast, ovarian, cervical, testicular, pancreatic, liver, etc. So that is something that definitely needs to be kept in mind with this syndrome. So what are the signs and symptoms of Peutz-Jeghers syndrome? The polyps themselves can cause recurrent bowel obstructions, chronic bleeding, and abdominal pain. One may also notice the brownish or bluish gray spots on the lips, gums, inner lining of the mouth, and skin. These patients may also have clubbed fingers or toes, cramping pain in the belly area. Dark freckles around the lips of a newborn may also be seen. They may also have blood in their stools because these polyps will have a tendency to bleed. And they may also suffer from vomiting. So how is Peutz-Jeghers syndrome diagnosed? PJS is diagnosed based on the presence of polyps in the small intestine, melanin spots, and a family history of PJS. So remember we said in the beginning that this is an autosomal dominant disorder. So if one parent suffers from this disease, each of the children have a 50% chance of also suffering from the disease. So this can also help us in the diagnosis because if the parent suffers, there is a very big chance that the child is also suffering from the disease. The small intestine is evaluated in two ways for the presence of polyps. One is a barium X-ray or a small bowel series, and the other is a capsule endoscopy in which a small camera is swallowed and then takes many pictures as it travels through the small intestine. Molecular genetic testing for the STK11 or LKB1 gene is also done to confirm the diagnosis. Treatment. Surgery will be needed to remove the polyps that cause long-term problems, such as recurrent bowel obstructions, chronic bleeding, and abdominal pain. Iron supplements can also be prescribed to help with anemia because gastrointestinal polyps can result in chronic bleeding and hereby lead to anemia. So because these patients have these polyps and food is constantly abrasing them and passing by them, they will have a tendency to bleed. And because of that chronic bleeding, little spots of blood here and there from all these different polyps, the patient may suffer from anemia. So we can give them some iron supplements to help with the anemia. Regular screening for other cancers. Remember we said pancreatic, liver, lung, breast cancer, ovaries, uterine cancer, cervical cancer, testicular cancer should also be done. So remember they have a mutation in that tumor suppressor gene and therefore they're more prone to cancer, so they have to be actively screened for possible cancers in the body. And that brings us to the end of the presentation. Thank you guys so much for watching. This was a quick analysis on Peutz-Jeghers syndrome. I hope you found it very informative. Please make sure you hit that subscribe button, like, comment, and share. And if you would like to download a copy of this presentation, you can do so by clicking the link in the description. Take care and bye for now.
Conclusion. Simili polypectin, preferibly using DBE methods, are essential for patients with PES. Follow-up of gastrointestinal polyps is necessary. The best combination of methods in capsule enteroscopy and enterosclerosis. If a long screening of malignancies is indispensable on regular basis, is necessary to investigate at first degree the relative of patients also. The incidence of PGS in lung is important for clinical diagnostic disorders to prevent morbidity and mortality in these patients and to perform pre-symptomatic testing in patients at risk. Thank you.